We're pleased to be able to welcome Anna Chorniy to UT Austin today for this event hosted by the Center for Politics and Governance. My name is Ryan Streeter. I'm the executive director of the center, and I'm glad to have you all here today. And I'm really glad that we have Dr. Chorniy here from Princeton to talk about a very timely issue, which is how the Affordable Care Act is going, and particularly one specific aspect, how it's affecting labor markets, particularly for young workers and the mobility of those workers. So please join me in welcoming Dr. Chorniy to UT Austin.
Thank you. Thank you everyone for being here. Okay, I'll put it here. Last time I was presenting, so actually a lot of my work is on ADHD. Last time I was presenting and illustrating what ADHD is, and unintentionally it went flying, so let's see. Be careful around me, so here. All right, but as I said, so my general interests, I work at Princeton Center for Health Wellbeing as a postdoc. I did my PhD at Clemson University. It's in South Carolina, and as I heard, you have another excellent speaker coming from there very soon. So my work is in general related to health markets. So my interest is here I would present the part that is related to labor market outcomes, but I also have work on mental health issues and how they're regulated, particularly under Medicaid policies. So yeah, if you have an interest, we could certainly talk about this as well. All right, but today I'll talk about how the particular provision of Affordable Care Act, dependent coverage mandate, affected job mobility among young adults. And sure, I should give credit to my co-author, who is assistant professor at Creighton University, and he has a lot of work on Affordable Care Act and state-specific mandates that sometimes preceded Affordable Care Act. So if you're interested, definitely go visit his website. He has a lot of work there posted, and some is published and some is in progress. But yeah, great researcher. So getting to the main point. So in the US, health insurance, as you probably know, is tied to the employment still. And the majority of non-elderly people get their insurance coverage through their employer-based plan. So about 70%, it's averaged across several years. Right now, it's a little smaller than it was in, say, 1999, but it was at 72%. Most individuals who have private insurance have it through the employer. So, as we all also know, and this is very relevant to today's talk, insurance affects your healthcare spending. So, for example, I could cite here Oregon Medicaid experiment that was in 2008 when some people were randomized into Medicaid and they got coverage. And what did researchers found? That immediately once they got coverage, they spent way more on healthcare than they did without coverage. And so this is important for today's talk because people care about having insurance. They spend they spend on health. So why is employer-provided health coverage is so prevalent? For several reasons. So first, it's tax exempt, and there are tax provisions for both employer and the employee, which makes it cheaper for both sides to obtain than individually. It also reduces adverse selection because each employer gets a pool of enrollees. So then there were studies that found that it reduces adverse selection. So for example, Gruber has a 2000 paper that talks about this. It is also found to be cheaper than equivalent policy that you could go and obtain in the individual insurance market. Certainly it reduces search costs. Like suppose when I got a job as a postdoc, I got a package that said, oh, you have 3 options. Great, right? I have just 3 options to look through. Of course, they gave me 30 days and I waited 29 of them before I even looked through this because, they still have to actually, it's a complicated thing to go through every plan and every option. So search cost is a real thing, as I will talk later as well. So what is this job lock problem? Well, there was this survey, employer survey, that found that 25%, and I cite just one kind of study that other studies found similar numbers. So 25% of workers find that aside health insurance is important, a reason why they do not change jobs. So insurance keeps them with their job. This is what job lock is. And the reason is when you switch a job, so first, new employer may offer no plan at all, so you will be without health insurance. Or maybe they will offer an inferior plan, which is actually very hard to even estimate when you're thinking of changing jobs. It's usually kind of black box. What do you get in terms of insurance? Unless it's really superior program that they advertise as a part of the employment package. Then there are those switching costs I talked about before. So you have to lose your healthcare provider when you change jobs because it's a different location, different plan, different people. There is also this new plan design. Again, you have to go through co-insurance provisions. You need to go through the list of providers, figure out what our deductibles are under your plan. And actually, there is increasingly more papers in the literature that trying to estimate what is the social welfare lost when you do switch job and you have to go through all this. What are the switching costs? And for example, here I cite one study that found that employees are willing to forego about $2,000 just not to switch jobs and not to go through this process of dealing with new health insurance. And there is a lot, also if you're interested in this kind of topic, there is a lot of literature on Medicare, particular Part D provision, because there are many insurance plans there, and elderly individuals are even less excited about picking, across different options. So a lot of literature, including behavioral economics, trying to estimate, how good or bad are elderly individuals into even distinguishing between the options, forget picking one. And finally, so maybe if you switch a job, you will be unable to even keep your insurance due to adverse selection, and maybe you have some health conditions that would preclude you from getting insurance. So all this creates a number of concerns over employer-provided health insurance, and as a factor that reduces your job mobility. So you're stuck with your job, you want to keep it because of these reasons. And just to give a formal definition, so job lock effect would be a reduction in labor market mobility due to concerns about losing employer-provided health insurance coverage. So regulation, not surprisingly, addressed this particular issue in the past, and it's not just a recent event when for Affordable Care Act actually advertised it, but in 1985, the legislation was passed that allowed employees to remain on their insurer coverage for up to 18 months after they left the job. Well, the caveat that actually they had to pay higher premiums for that, but still they had an option to have insurance even though they left the job for some time. In 1996, there was another legislation all those acts, of course, contain a lot of different things. I'm just pointing out some features relevant for our discussion here. So HIPAA limited the ability of insurers to exclude individuals with pre-existing condition, which was a big deal for individuals who had some and they just couldn't obtain coverage on the individual market. And then finally, the topic of this discussion is the part of the Affordable Care Act that is called dependent coverage mandate, and that specifically, I'll talk in detail, but they do cite job lock as a concern and as a reason for why this legislation is good. This is how they justified, in part, passing the legislation. So looking at the job lock effect in the data turned out not as straightforward because of the statistical issues that we face. It's just not random who has insurance, who has a job. So there are several different empirical strategies that people employed while looking at that. And kind of standard identification strategies or how do you get to estimate the effect of job lock is to compare mobility, say, of married people who have spouses who have insurance, and thus, say, suppose my husband has insurance provided, the employer provides coverage, then I shouldn't be worried about my employer, because then I could just get coverage through my husband. But then if I had a husband who doesn't have insurance, then probably I would be really worried to stay in my job, not just because my own coverage depends on it, but maybe my husband's coverage depends on that. So people played around with this kind of strategy. But the problem, it's still not perfect, of course, because not random people are married, right? So there's there's significant differences between married and unmarried individuals, which are hard to take into account when doing this research. And so, and another kind of strand of literature, they tried to look at individuals who have high healthcare costs versus low healthcare costs, so healthy to relatively unhealthy individuals. Because as you can imagine, the value of having insurance in your job is higher for those who have relatively low level of health. But again, you can see it's similar logic applies as with married and non-married people. It's not random, usually, what kind of health you have. And it depends on all other factors, including it determines whether you're employed or not. So here I just cite several studies that produce some evidence on job lock effect. So a fairly famous review is by Gruber and Madrian in 2002 that they review a lot of literature, and one particular clear finding is that insurance reduces mobility between large employer jobs. I should say probably I should have said it a little earlier, but there is quite a bit of disagreement in the literature in terms of what kind of effect of job lock they find. Some find no effect, and some find positive effect of job lock of job lock, and then others find none. And actually, that's why I reviewed those identification strategies, because none of them is perfect, and some people find an effect, others don't, and there's still disagreement on which is the most credible study. So actually, there's still room in this research if in case you're interested in digging into this. The third line here I wanted to point out. So there was a paper on Medicaid expansion that also was found to reduce the job lock among single mothers only. So this is to point out that people try to stratify what populations they're looking at, trying to find out maybe some populations are affected and others not, and this is where we are finding differential results in the literature. And then an interesting paper by Barkovsky, so it's still in revisions, but he differentiates job lock and job push effect also from Medicaid expansion. And job push, you could think, okay, job lock I explained, right? So I'm afraid to lose a job because I have insurance provided through a job. But job push is different in the sense that maybe I want to get a job because I want to have insurance. And I think it's an interesting study that I invite you certainly to look into if you want to learn more about that. So what is that we do in our paper here that is different from the literature, and how is that we contribute? Well, first, we provide evidence specifically on the latest legislation that is concerned about job lock, and it is Affordable Care Act dependent coverage mandate. And we look specifically on job mobility and not, say, participation in the labor market, so it's more like whether people change jobs or not. We look at the young adults, and it was relatively understudied populations because of the data constraints. I think most studies look at the fairly broad population of 20 to 55-year-olds. And we arguably avoid some endogeneity concerns that other papers had, just because we have, increase in health insurance availability that is arguably exogenous and helps us in identifying the job lock effect. So what I'll talk about next, just to summarize, the objective of our paper is to estimate the effect of job lock on young adults due to this specific mandate that was concerned employer-provided insurance. We will use current population survey. For estimation, we'll use difference in difference, and of course, I'll explain it all in detail. And preview of the results is that we find no evidence of job lock for young adults, and I'll be happy to discuss why we found this and what do we think about it. So just a little bit of background, and let's see, clock here. So Affordable Care Act was passed in March 2010. There were a lot of provisions there. I just listed a few, say, individual mandate is probably the most famous, that everyone has to have insurance or pay a penalty. There were subsidies introduced for anybody from 100 to 400% of federal poverty line. There were exchanges introduced. And then some states expanded Medicaid under the same law. So there is really a lot going on. So, and most of these provisions, they didn't take effect until 2014. But the dependent coverage mandate that we are looking at was passed also in this March 2010 law, but it took effect very early. It was one of the earliest provisions, and it started in September 2010. And this is why we were able to estimate anything at all, because by now there is clearly enough years of data that we can look before and after the provision and see what is going on. So what does it do? What is the provision itself? So it requires family health insurance plans that are employer provided to offer coverage to children, but not so children, right? So young adults from 19 to 25 years old. Young adult now, under this legislation, does not have to either live with his parents or be a dependent on a tax return or be a student to be eligible. So it's just the age requirement. All other requirements were eliminated by this law. And prior to the Affordable Care Act, so child was typically covered until 18, 19 years old, or sometimes until 24 years old if a full-time student. But again, dependent coverage mandate just eliminated these provisions. Before we dive into the effect of the mandate on the job lock, we first really want to know whether it worked at all. Did individuals take up this coverage, right? Because if they didn't take it up, there is no effect to look at, right? So first, I just want to say that some states, and we will use this variation in the robustness checks, had some laws somewhat similar to the dependent coverage mandate of Affordable Care Act, but they were very strict. They were also concerned mostly, all these restrictions I listed, kind of not randomly, that you have to live with their parents or be dependent on tax returns, so they were mostly more stringent. But the literature looked at that, and after Affordable Care Act, there was really, despite those pre-existing laws, there was first increase in insurance rates, meaning insurers responded that there were more people getting coverage, so they increased the insurance rates. And this same paper found that there was a 30% increase in young adults on their parent insurance. So the effect worked in the sense that people took it up. Okay, and there was a paper, so 2012 and 2013 papers look at some of the labor market outcomes. So they found the reduced labor supply and employment by these individuals who became now eligible for their parent insurance. And my co-author has a paper where he looks at the entrepreneurship, meaning self-employment, and he finds that there was a slight increase in self-employment following this dependent coverage mandate. We will look at the same natural experiment of the provision of dependent coverage mandate, and we will look, the idea being that when individuals have secure health insurance, that is not tied to their job, maybe especially young adults would be more likely to switch between jobs, right? Or leave the labor force altogether. And so we will look at our treatment group are those individuals who gained coverage as a result of the mandate. It's 19 to 25 years old. And as a control group, we follow previous literature, and I will address some critique about how good this control group or not as we go along. But we try to get the closest groups by age that are as similar to 19 to 25 years old as possible. And so we included individuals who are just a little bit younger and just a little bit older as a control. And before defined simply before the mandate and after the mandate. And so the empirical estimation is fairly straightforward. So on the left-hand side, I have a binary variable that is just says 0, 1, where the individual switched a job 0, 1 in a certain time period. And then on the right-hand side, I have a coefficient of interest is B3, beta 3, that goes that tells you what is the effect of the mandate of the individuals of our treatment group, 19 to 25 years old. The data we will use for this is a current population survey. It's a great data source, and probably many of you worked with it. We use this basic monthly component that interviews individuals for 4 months, and then in a year, they interview the same individuals again for 4 months. So we took this data, and it's free. So if you haven't used this data, it's actually available to you right now. So we used 2008, 2013, which are years just before the mandate and just after. And we ended up taking just these 4 first data points for each individual, because if you work with this data a lot, you will realize that they don't have the longitudinal ID for each individual. And actually, there are several programs written how to link these individuals over time. And we did that. We linked all 8 data points, but unfortunately, the match is not perfect. So just to be sure, and it was enough for what we were trying to do, we just took the first 4 months of this survey for each individual. And the question of interest from this survey that we used goes, I just quote it, last month it was reported that you worked for, and then it has an employer name in the survey, and it asks, do you still work for this employer? So if the individual says no, we count as they switched their job, okay? And if they say for 4 months in a row, they say, yes, I work for the same employer, well, they did not switch a job. All right, are we good? Okay, just a bit of summary statistics. So the sample in general is well balanced in the sense that we have roughly same group pre-mandate and after mandate in terms of the number of individuals. So let's see. Oh, I can point. Magic. Sorry. So if you look at the young adults, so this is our population who was affected by the mandate, about 6.5% of them switched the job before the mandate, and even a little bit smaller fraction of them switched the insurance after the mandate. So which is kind of counterintuitive, right? So we would expect that the theory would tell us if there was a job lock, we would see individuals switching jobs more. But again, this is just raw data, so it's inconclusive, but we just kind of look and trying to see if there is any preliminary evidence of do we see anything even in raw trends. Forget like other controls. But then control group, you would see they have a slightly lower mobility, and it did not change over time. So age, as you would expect, because we have young adults would be 19 to 25 years old, and control group is the 16 to 18, and then 27 to 32. So they're a bit older. Male and female are fairly balanced. We have a bit more whites, and education would be that is slightly different for 2 groups, just because, again, it's still different age. And I will be defending the control group throughout, because of course you would see some characteristics differ, but still, since we will be controlling for all these factors, what's really important is that they are on the same trend, at least before the mandate. Just going a little bit more about just finding raw evidence of any effect. We kind of look at what I showed you before. It's what is called basic difference in difference that you perform without, it's not a regression framework. You just compare, do we see anything even without controlling for any characteristics? And you would see, so yeah, before the mandate, the treatment group had a mobility that was a little higher than after the mandate. So the difference is 0.3 percentage points. And the control group had a slightly 1 percentage point, 0.01 percentage point difference. So again, raw data just doesn't show anything. And so this is the kind of the baseline we're going with. Another assumption so one of the assumptions that difference in difference requires is that these populations are on a similar trend before the mandate. Because if these groups are very different, there is no way I could justify using diff and diff. So the red line shows the average job mobility of the treatment group in our sample. And the dotted blue line, sometimes it comes out in different colors, but I think we're good here. The dotted blue line shows you control group job market mobility. And we can see they're not obviously on the similar trend, but at least they're not going in completely different directions. And so we just in addition to that, perform a statistical test that shows, just basically asks whether treatment group is in a different time trend than a control group just before the mandate, and we find no. It's very close to 0, and it's also a bit noisy. But even with the noise, it never goes. It's never big. So we conclude that we can actually use this control group that we chose, and it's very similar to what previous literature did as well. Okay. Just so the baseline results for the model I showed you, the diff and diff, shows that, and we did just to standardize the results with the previous literature. So linear probability model, meaning OLS regression with larger than probit just in case, and larger than probit here are actually marginal effects. So I'm not showing you odds ratios, it's actual effects. And we see that they are tiny. So this coefficient would tell me whether individuals in the treatment group had a different job market mobility after the mandate. And the theory again would tell you that we hope if there was an effect, if dependent coverage mandate relieved job lock, we would have a positive effect. So they would be more mobile, they would switch jobs more than they did before. But what we see here is actually a negative point estimate, but it doesn't even matter that much that it's negative, it's just so small. It's economically and statistically very small. So the baseline results are very consistent with what we saw in raw estimation. It really doesn't make any difference controlling for characteristics. Well, previous literature, as I pointed out, said, well, maybe there are some subgroups for which it really matters. Maybe in general, on average, it really doesn't matter whether you have insurance or not, but for some subgroups, it does. So first, we just compare, all right, we stratify the sample by women and men, and I'll be just pointing out the main coefficient. Others you can just safely ignore for now. The main coefficient, again, is no different for men and women. Well, and as I said before, so they found, in the previous literature, they said, well, married individuals are not job locked because they have a spouse potentially who has insurance. Well, we don't find evidence of that either. But remember, I'm talking about young adults here. So not that much. So very, especially for the young adults, the fraction that is married is just not big. All right. So next, and we're kind of following just the general literature. What did the literature do? Maybe we'll find a subgroup for which it is important. Well, we try to look at educational attainment, and the idea being that for relatively higher educated individuals, in general, finding a job that provides insurance is way easier than for individuals who are sort of unskilled labor. And education being a proxy for that, because we don't have any more specific job information. But we find no difference, no effect. So, I mean, there is some difference in the coefficient estimates, but none of them seems to be job locked. We also try by employment type. So maybe you would think individuals who go from employment to unemployment, or who are in full-time versus part-time employment, they're probably different. Say somebody who is employed part-time, they probably don't have insurance to begin with, so maybe it doesn't really matter for them whether you pass dependent coverage mandate or not. But again, it's all pretty puzzling. There is some difference in point estimates, but it's so close to zero that it doesn't really make any economic sense. So we don't see any group for which we could claim there was a positive effect of the dependent coverage mandate. And finally, so we had to defend it a lot, of course, as the paper that we are basing our research on. We had to defend our age groups because, of course, you can give me just, out of the top of your head, a million reasons for why 16-year-old is different from 25-year-old. So we tried the kind of sensitivity analysis on different age populations. And so we looked, say, at adults only, and we excluded the 16 to 18 years old to just came to exactly the same conclusion as before. It's kind of boring, but in the sense that, boring in a sense, there is no difference in the coefficients, but I guess we are just trying to prove the point that whatever stratification of whatever subgroup of young adults you look at, there is really not a group for which job lock is a relevant concept, okay? So we looked at just younger controls, and then we looked at just a very narrow group, so you'll see the sample goes very low from 100,000 that we had before. So we would just compare what happens to 23, 25 years olds comparing to 27, 29, whom we take as a control. And very similar result. There's just no significant effect. And I want to just repeat myself a little bit, but it's not just it's insignificant. We are going more for not just getting stars on it, but it's actually very small. Like it's not a very different from zero number, even if it were significant. And finally, so we also look at the effect by student status, because again, students are completely different people from, I guess, individuals who are just employed. And also, point estimates are slightly different, but also in part due to the huge difference in sample. But neither of them seems to be affected by the job lock either. Important part about looking at any sort of effect of legislation is to look at how anticipated was the law, and how, suppose it was passed in March, well, what happened between March and September, right? And actually, as it turns out, it was important. It is relevant for our study in the sense that after the law was passed, insurers were encouraged to start providing dependent coverage even before September. And then on another note, there was a provision for grandfathered plans that insurers who kept their own exact same plan, they didn't have to implement dependent coverage for a while. So it would be for another year, not until September 2011, when they actually had to implement, if they opted out to keep that grandfathered plan. So what we want to see in this estimates, we run the same regressions, but we exclude those periods that are gray area. So the first column would drop the official implementation period that we call, so September 2010 to September 2011, where potentially some insurance did not implement it. And we find the same result. We also drop, in the next column, we drop this March to September gray area. We also find similar effect. And again, we just try, well, what if mandate began in January 2011, just another kind of robustness check, and also find, so it's a very, what I'm trying to get at, it's a very stable result across, different specification and age groups, which convinced the referees and convinced, me while I was doing research that really there is not much here for young adults in terms of being job locked. And very, very final check. So as I mentioned before, there is quite a bit of work on those state-specific mandates that were similar to dependent coverage mandate, but they were introduced in every state. And there is a paper by DPU 2014 that looks specifically, and they describe each state's mandate. And usually, as I mentioned, so they would be a bit more restrictive. But there were a few what we call broad law states where they would actually go slightly beyond 26 years old. But they're just 10, and but we still want to double check, that the result holds, even if we account for that. And it does. So even in the states where there was a law, or there was no law, or we exclude those laws where they were more explicit than Affordable Care Act, still there is no effect on young adults after the Affordable Care Act. So to conclude here, so we contribute to the literature on job lock effects, taking advantage of the passage of dependent coverage mandate introduced by the Affordable Care Act in March 2010. And our main result that I hope I convinced you, I convinced myself through this research, and I hope convinced you that it did not reduce job lock or job mobility, so the probability that the individual would switch jobs, and in our case it's this 4-month interval of the survey. So we conclude here that job lock phenomena is not an issue for young adults. And let me just here probably say a little bit for why we think it is the case. So maybe you noticed in the beginning I told you there were two main strategies that people addressed. They looked at married individuals and individuals of different health. So we looked at married individuals in our robustness checks, but we do not have health information. So maybe there is a subgroup of these young individuals who are just of very poor health, and it would be a small group, but potentially they have a pre-existing condition, and for them, maybe we would be able to find an effect. But we were not able to do that, so because we just don't have data, so there's a little niche here for research. But overall, again, all other bases I think we covered, and we found no evidence of the job lock. Just combining the evidence I gave you in the beginning that people did take up this insurance under their parent plans, but they did not become more mobile. So what we make out of it, these two pieces together just probably say that for young adults, it's not insurance. For adults between 19 and 25, it is not an issue. Again, what is good and bad about our study, I guess, the good and advantage and disadvantage in the sense we look at a very specific population, we find very precise zero effect, but it might be not applicable to the general population. And just briefly tell you that there are certain extensions that can be done. So first, the Affordable Care Act itself, exchanges and all that, was introduced later. So now researchers started looking at the effects on general population as well. So that would be interesting to see. Medicaid expansions, there were some studies, but still not enough, because especially recently there was a lot of movement. So states got federal money in 2014 to expand their Medicaid, and some states took the money and expanded Medicaid, but now 2016, 2017, they're not getting as much or not at all federal money. So some of them are facing the problem, what do they do now? Because actually state Medicaids programs are not in a great shape financially. So there is a lot of interesting research to look at what states decide to do and what do they do about expansion versus non-expansion versus expansion, and then maybe potential reduction in insurance coverage as well. There could be work trying to introduce this new idea of job push, trying to reconcile the idea of job lock and job push as search for more jobs that have insurance coverage. Do people maybe now don't have to search that much for jobs if they have access to Medicaid? And finally, dependent coverage mandate itself potentially could be used to answer some other interesting questions. For example, we didn't talk at all about, well, what is the wage? What do the wages look like? If you have now insurance available through your parent employer, clearly there is the theory of compensating differentials. Maybe now my wage has to be higher for me to go get a job. So that would be an interesting question to look at as well. This concludes what I wanted to tell you about, and I'm open to questions about this. Sure.
Do you think, I'm just curious, like the age group that you looked at, did you look into like maybe people in that age group don't really place that much importance on health insurance because it's typically relatively healthy individuals? Is that something that you looked at, like why that might not cause any statistical significance?
Right. No, that would be a great question. And I mean, it would be good to have something, even a companion kind of survey question where we would have young individuals saying, oh yeah, we don't care whether our job provides insurance or not because we don't take it anyway, something like that. I mean, that would be good to have it, but unfortunately, yeah, if you find it, write a paper. Yeah. Yep.
Just talking to the mic for the recording purposes would be great.
Thanks. Hi. Excuse me. I'm curious about the timing of the natural experiment. So it coincided with a economic recovery from a terrible recession. And one of the things that happens is you get depressed job mobility among everybody during that time. So I'm curious if you think that this can bias your results, or at least make it harder to find any kind of effect when maybe that overwhelms the decisions to leave a job or not, if it's just determined by the economic circumstances. And I would just love to see the job mobility time series extended both ways for that reason. I think this may be something that Medicaid expansions might help you get at better, but and there's obviously no other way to model it if you're going to model as a natural expansion, a natural experiment. But I'm just curious if you think that's a problem, and if so, how would you account for it?
Right. No, this is actually a very, very good question. And it was a concern for the referees as well, of course, it's a big concern. And Medicaid, just to tell you right away, Medicaid doesn't help that much because usually during downturns, Medicaid expands and then so it's not perfect either. But so all we could do to defend the result is look at the individuals who were always employed. So during downturn or no downturn, who was employed in every single month, presumably they're probably a category who could, if they wanted to, they could get another job, at least more likely. And for them, we find exactly the same coefficient, which is, it's still not perfect in the sense that you can say, well, they felt, maybe during downturn, they felt like they couldn't switch a job. But the best we could do is just concentrate on this one group and to address the question. But yeah, of course, this is a very important issue that is hard to address in full. Yeah.
So your binary switch variable was just based on whether you're still working for the same employer, correct?
Correct, yes.
So did you try to ask the question whether there was a change in their full-time status? So the reason why I'm asking this is because it could be that after the passing of the mandate, there was a reduction in the demand for labor.
Right.
So employers were having incentive to either switch to hiring more part-time status, where before the mandate, maybe people, especially the young people, were starting at a part-time and switching to a full-time more often than after the mandate.
Yeah, this is a great question. Unfortunately, we were very lucky to have a separate variable that indicates whether you're full-time or part-time. And we actually used it, I guess from the questions I understand, I went over this table way too fast, but we were able to separate full-time from part-time. And let me see. Yeah, but we actually, so here they just ignore the switch. But that would be actually a good question to see if they were mobile across the two? Because probably part-time doesn't involve insurance. Yeah, that's a great question. Yeah, I wouldn't do it.
Any other questions? Well, if there are no other questions, please check back on our future events lists. And for now, just join me in thanking Dr. Chorniy for being here today with us today.
Thank you.